My presentation is a brief synopsis of systemic lupus erythematosus. I was first introduced to this disease by a friend of mine who was recently diagnosed. After years of unexplained symptoms, she was planning a pregnancy and a blood test came back with elevated anti-nuclear antibody levels. This only added slightly more concrete evidence to the slew of symptoms she had experienced for years. Lupus, unlike many other conditions, is not solely diagnosed by any one test result. Lupus is diagnosed as a culmination of problems. Systemic lupus erythematosus is an autoimmune disease affecting roughly 1.5 million Americans. Females, more specifically African American women and Latinas, are more susceptible to the disease than others. Common signs and symptoms of the disease include erythema, such as the butterfly rash found on many patients' faces. I've included a photo of the stereotypical malar rash to the right of the presentation. Other symptoms include arthralgia, nephritis, photosensitivity, and Raynaud's phenomenon, to name a few. Nephritis is diagnosed by a positive urine test. Among the most severe symptoms of lupus, a patient may experience extreme malnutrition as the individual's immune system attacks the intestines. Lupus does not get worse as a person grows older. Rather, the patient will likely suffer from flare-ups their entire life. Unfortunately, there is no cure for lupus. It is often managed through the use of corticosteroids to hinder one's immune response. Although corticosteroids suppress the immune system, hindering autoimmune attacks, it also opens the patient up for increased risk of infections. Non-steroidal anti-inflammatory drugs are often used to ease arthralgia and edema of joints. Sunscreen is also highly recommended for patients with photosensitivity, as it may reduce the amount of skin lesions and scarring. There are many references available if one wanted to learn more about lupus. Particularly, www.lupus.org has been of great importance to my research. Lupus does not seem to be a very well understood disease as of the current time. However, there is still research being performed daily. Thank you for viewing my presentation.